We tend to think of antibiotics as a pretty straightforward deal. You get sick, you take a pill, you get better. Simple. But what if the cure could actually be the cause of a whole new problem? We're about to dive into a wild medical paradox where the very thing designed to heal us can sometimes unleash something even worse.
And that question, it's not just a thought experiment. It's a real medical puzzle. And it's at the heart of a really challenging infection called Clostridioides difficile, or as most people call it, C. diff.
So what exactly is C. diff? Well, it's a bacterial infection, and it causes some serious inflammation in your colon, a condition we call colitis. But here's the real kicker. The number one trigger for this nasty infection is taking antibiotics. So how in the world does that happen? It all comes down to a hostile takeover that's happening right inside our gut. Okay, to really get this, the best way to picture it is to think of your gut like a thriving, balanced garden. It's packed with thousands of different kinds of bacteria, and most of them are totally harmless. They're all just living together, keeping each other in check. So in a healthy gut, a little bit of C. diff might be hanging around, but it's no big deal. It's just one of the crowd, totally outnumbered and kept in its place by all the good bacteria. But then you take a course of antibiotics, and it's like a wildfire, just tears through that garden, wiping out pretty much everything. Well, almost everything. C. diff is a really tough survivor, and suddenly, with all its competition gone, it has the whole place to itself. Let's walk through the chain of events here. First, you take antibiotics for some other infection. They do their job, but they also knock out a ton of the good, protective bacteria in your gut. This creates a massive power vacuum. C. diff sees its chance, and it starts multiplying like crazy. And then it starts releasing toxins. It's those toxins that do the real damage, inflaming the colon and making you sick. So who's most at risk here? Well, pretty much any antibiotic can set this off. Some are more known for it, like penicillins. But it's not just about the drugs. Being older, spending a long time in a hospital or a nursing home, or even taking common acid-reducing medications can all seriously increase your risk. All right, so we get how it happens, but what should you actually be looking out for? What are the warning signs? Let's get into the symptoms. Now, this is where it gets really interesting, the timing. You'd think the symptoms would pop up right away, and sometimes they do, even on the very first day. But usually, you're looking at a window of about 5 to 10 days after starting the medicine. And get this, symptoms can show up as late as 2 months after you finish the antibiotics. That's a huge and honestly kind of scary window. The symptoms themselves are on a real spectrum. A mild case might just feel like some cramping and maybe some loose stools, but it can ramp up to a moderate case with bloody diarrhea and a fever. And in the most severe cases, we're talking about a true medical emergency with life-threatening dehydration and even the risk of the colon perforating. It's incredibly serious. So given how bad this can get, how do doctors actually tackle it? Well, the approach is pretty methodical, and it starts with one very logical first step. It seems almost too simple, right? But it's the most important first move you can make. You have to stop fueling the fire. Doctors will immediately take you off the antibiotic that they think triggered the C. diff overgrowth in the first place. So here's the game plan. Step 1, stop the antibiotic that's causing the problem. Step 2, and this is ironic, is to start a different antibiotic, one that specifically targets and kills C. diff. At the same time, they'll test your stool to confirm it. But here's a super important point, and it's a bit counterintuitive. Doctors will tell you not to take things like Imodium. It seems like the obvious thing to do, but that can actually trap the toxins inside your colon, making everything a whole lot worse. For many people, that treatment works just fine. But what happens when the C. diff comes back? This is where medicine gets really, really innovative. The focus shifts from just killing the bad guys to actually rebuilding the entire ecosystem of the gut. This number is everything. For up to 1 in 5 people, that's 15 to 20%, the infection comes roaring back, even after treatment. They get stuck in this awful cycle of recurrence because their gut's garden is so wiped out that C. diff just finds a way to take over again and again. So that leads to the big question. If the real problem is a totally destroyed ecosystem, how do you fix it? You can't just plant 1 or 2 good seeds. You have to somehow bring back the entire diverse garden all at once. How do you do that? And here is the truly groundbreaking solution. Now, it might sound a little strange at first, but it is an unbelievably effective treatment for these recurring infections. It's called a fecal transplant.
Let's just break down how this works because it's a very serious, controlled medical procedure. First, stool is collected from an extremely healthy, carefully screened donor. That sample is then processed and prepared for transfer. Then it's introduced into the patient's colon. And the goal is simple but so powerful. That whole community of healthy bacteria from the donor just floods the patient's gut, completely crowding out the C. diff and restoring that natural healthy balance.
It really all boils down to this single idea. You're not just trying to kill one single enemy anymore. You are rebuilding your entire defense force. The fecal material from that donor literally restores the normal, healthy balance of bacteria in the intestine. You're basically getting a complete, healthy microbiome transplant.
And that just leaves us with a really fascinating thought, doesn't it? The incredible success of fecal transplants for C. diff just shows how unbelievably powerful our own gut microbiome is. It makes you wonder, what other health problems could be treated not by targeting a single germ, but by restoring the complex microscopic world that lives inside every single one of us? It really feels like a whole new frontier in medicine.